Now, Wellness Wednesday on Fox 54 News, sponsored by Regenesis.
Sickle cell anemia, an illness you might have heard of. It's a blood disorder that affects the shape and function of red blood cells, and its impact mainly felt in minority communities. We get a closer look at the disease this Wellness Wednesday. According to the CDC data, the majority of people who have sickle cell disease are Black, and those with the disease are likely to have a shorter lifespan. But data also shows that those with this disorder might not seek medical care, something one local doctor understands. Lizzie Elmore, a professor at UAH, described what sickle cell disease is and how it can be harmful to the human body.
Sickle cell anemia affects the red blood cell in the patient's body. So it creates an abnormality, and so the red blood cell is actually sickle shaped. So it prohibits the red blood cell from helping with oxygenation in the body.
There's sickle cell and sickle cell trait. Sickle cell is when someone has 2 copies of the gene. Sickle cell trait is when someone has 1 copy. Elmore says if you have sickle cell traits, it's important to make provisions before having children.
Something to think about as you grow your family, to have those genetic screenings and genetic counseling to ensure the knowledge base is there.
Screenings are done quite early in life to check for the disease, as described by Dr. LaToya Solomon.
We do screenings here in the state of Alabama. We do newborn screenings. We do them twice. We do them at birth and we do them again at 2 weeks. And that is typically, that will pick up on this particular disease process. And so unless you have a patient that, maybe didn't get the proper health care, usually we know by the time they're about a month old if they have it or not.
Doctors advise to be proactive and get ahead of the disease.
Patients who experience severe pain, they may have infections and things like that, will unfortunately experience a sickle cell crisis, and those patients are treated more in the inpatient setting in the hospital to receive fluids and other treatments to help dissipate that sickle cell crisis.
Solomon points out that it's important to start with the right provider.
A lot of times it's not necessarily just having a Black provider, but just having someone that has some of the same experiences, that shares some of the same backgrounds, that listens to their concerns.
Sickle cell disease is a genetic condition that can't be prevented, but you can reduce the risk of complications by taking a blood test to determine if you have the genetic mutation that causes the disease.